session brought to you by the Integrated Health and Wellbeing Council, with the CEO as Kamal Narayan at the helm of affairs, and deeply supported by the Bharat Serum, whose mission is building Bharat in every possible way. So this is a great opportunity for all of us as stakeholders. Well, 1 to 2:30 is lunchtime. So this is a luncheon meeting, ladies and gentlemen. We are all at the lunch table and my colleagues are going to speak from their heart. In the interest of time, I'll be just, mentioning the names of all the panelists who are here, and as we go on, move from one panelist to another, we will give you more of their background, and the questions which I'm raising are specific to a large amount of accomplishments they have had in their journey from birthing babies to making babies. Why is this title? So as I recall my own story, 40 years back when we were medical students, delivering babies with heavy labor room duties, 24/7, day in and day out, pulling out babies all the time, where this infertility as an issue and as something that we can do to assist reproductive processes by the technology-driven things was completely a no-no. So when some patients used to present with infertility, we in our career used to think that they have no better business than making babies. There's so much to do with education and career and this, that, and all. That was our mindset. The story goes like, why is it so important for that particular couple? Okay, that is, a bundle of joy which they have been anxiously waiting for maybe months, years together, is a whole different world. So from birthing babies to making babies, how have these stalwarts? We have on the panel today Dr. Jayam Kannan, Dr. Devika Gunasheela, Dr. Vidya Bhat, Dr. Shefali Jain, young only Neharika Malhotra, and another galaxy in the star, Dr. Rekha Rajesh, and the one and only KD Nayar, male member for the cause of women's healthcare. So welcome all of you to this, what we would call reflections and recall of your own journey from birthing, making babies. So let me begin with Dr. Jayam Kannan, who we have known as a very accomplished OBGYN with several decades of practice. As I mentioned to you, many decades ago, we were only in the business, if you call it, of birthing babies. So she's still with major initiatives of helping mothers survive. She has been the vice president of our organization, Foxy, and she's won many awards to her credit and practices both in Chennai and Kochi. But she is literally all over the place. As you can see now, she is in some exotic location. So this is Jayam Kannan. I want to ask her the question on how was your thought process when you inspired or got initiated into the process of making babies, by which we mean anything to assist reproduction. How did you get into it? Jayam.
1978, when Louis Brown was born, many of the present faculties might not have even entered medical college there, or they would have been undergraduates. They would not have known the importance of Louis Brown delivery. By the time I am already 8 years into my practice, at the primary health center, my first delivery was a 6 years married, Dhanalakshmi in the rural area, 48 hours of labor pain, force of supplied, baby okay, cervical tear, sutured, and my journey started with such infertility and operative obstetrics. I still cannot forget that girl. And 8 years after that, when Louis Brown was born, next month my clinic, which was already seeing about 1,000 deliveries a year, started getting the 10% of the patients who long for a baby. Madam, London, they are having a baby. Can you get that into Tiruchirappalli and make me get a baby? There are some people, Madam, can you give me a reference so that I can go to London and get the baby? Look, My journey from such a heavy operative obstetric practice, also with a couple of hysterectomies daily at that time. Imagine, think of doing a infertility practice which was nowhere known. 82 we started endoscopy. By that we were able to do some tuboplasties and give some success. By the end of the 1980s, I could not resist these patients' need, so I started hunting for from delivering babies to creating babies. I was giving then, but I couldn't know. Then I should start my IVF center. But the journey I took was so much. I have gone to every center in India, at that time 4 or 5 centers, including Neharika Malhotra's father's clinic at that time in 1991, when Jaydeep had organized a meeting. And I have been trained with Kamal Ahuja and Bian Chakravarti. But down south, the one person who allowed me to see everything in the IVF lab and gave me training on IUI is Professor Gunasheela. Both of us went in 1991-92 to IVF conferences. She used to say, Jayam, IVF is a bottomless pit. You don't know what you are putting in and how much money you are putting in. You don't know whether you will get success or whether you will get the money back. That was such a frank lady. I used to be there every 3 months. I'm very happy to see Devika here. And I have been at a distance, a big admirer. And she gave me a peep into the IVF laboratory. Of course, I've seen Kamal Ahuja's lab there and B.N. Chakravarti. So B.N. Chakravarti used to have only 8% success in 1989-90. When somebody else was saying 40% at Mumbai size. But he used to say, Jayam, we are getting this much only. Let us see what we have to do. Probably we'll keep continuing that. A person who has started even before Bombay group, he was there into IVF for the past 10 years. Still he was saying that. So at last, 1992 I started. 1993 we had IVF delivery, normal delivery, not in my center, at 80 kilometers away in Kumbakonam, delivered by my own classmate. What a surprise. Now I don't think any ART people will leave the patient to even move out of the compound. That is the thing. But of course, my journey has been continuing along with my operative obstetrics to the present state of IVF, in which in my center, even PGD is being done, thanks to Priya Kannan, whom I have brought her into IVF training. She is the first person to go to Australia, to Monash. She officially is trained with Masters in Clinical Embryology. And Alan Tronson with endometriosis. And she came back. She is even now, VIP in Australian Embassy. People used to ask me, why you have put her in, not in DGO? No, after obstetrics, many people are going to practice and going to leave, because by the time people started making a lot of noises. The polite patient atmosphere turned out to be a political atmosphere. So I knew my daughter is not going to be comfortable. So let somebody do the obstetrics, let her do the creating babies. That is how I have gone into this journey. Till date, I continue with that.
Yeah, thank you. Thank you so much, Jayam. Jayam has gone all over the place, making history, breaking the geographic boundaries, if I may say so. And I think it has been, a finest example of where there is a will, there's a way. And she has found her way negotiating, whether it's Kumbakonam or Tiruchirappalli or Australia or Monash or wherever. So congratulations, Jayam, and very well said about the kind of person whom we admire, who has left a legacy behind, Dr. Sulochana Gunasheela. And when I say legacy, it's not only the legacy of many, many teachings that she has given to so many of us, but the legacy in the form of Dr. Devika Gunasheela, who heads Gunasheela IVF Center in the city of Bengaluru. And she has also not only passed on the knowledge and attitudes, but it is so much to do about ethics and quality. So how was it, Devika, to take over such a massive mandate by your beloved mom, and you had to shoulder the responsibility and paid, if I may say, with the huge volume of already existing practice, both delivering babies and making babies. That's how the center was. And like Jayam, we all have been in and out of that many, many times to get inspired ever so often. Each time it has brought such strong and fond memories. So Devika.
Thank you, madam. Thank you for having me on this panel. What I want to say is that, like Professor Jayam as well as you said, my mother was a legend of sorts, and we did have the first IVF baby in South India sometime in 1988. That was 10 years after Louis Brown was born. And I came back from England along with my husband. We'd done our MRCOG, he had done his FRCS, and we came back in 2000. So my mother passed away in 2012. And so by that time, she had already laid the foundations for a lot of ethics, and the practices were set. And so it was just like, getting into a good, well-fitting glove. And after I did my master's, I came here and did my fellowship and continued. And I was lucky enough to have her guidance for about 12 years before she passed away. So from the ethical front, we were very strong. The foundations had been laid, and nobody could even kind of, get out of that kind of a boundary that was there encircling all of us. The knowledge is a continuous process, gain from her, gain from reading. And it's still going on now. That doesn't ever stop. The thing is that there were few challenges. It wasn't so much the practice as such, but then trying to get into her shoes, so and that's very difficult to try and get into somebody else's shoes. At the end of the day, you should create your own shoes. Your shoes should fit well onto your legs, and then you leave the footprints on the sand. You follow in your in your mother's footsteps for a certain time. And then there were a lot of comparisons, and I do not know if Neharika is also kind of finding the same thing, but a lot of comparisons, because it was from the colleagues. You felt that everybody was watching you. So it was your staff who was watching you, your colleagues, senior colleagues, who were my mother's contemporaries. And I also had, a lot of people coming and tell me, the senior colleagues saying that, oh, your mother's not there anymore now, so let's see what you're going to do. So so that was always, so you always felt that somebody was watching you, and you had to kind of live up to that stage. And then after that, you kind of become mature and you say, okay, fine, she was a legend, and this is what I can do, and this is what I'm going to do. And you lay a path for yourself, and you just walk along that path. But then the foundations are already there. The other thing that was there was that when a person like her, who was all in charge, goes, there's a vacuum that is left. So you have a lot of insecurities that are there. But then I found that one of the main insecurities was, what was going to happen to my embryologists? Were they going to leave? Because finally the embryologist is the pujari in the sanctum sanctorum, and without them you can't do anything. So it was like, oh my God, we had these really senior embryologists, and it was like, oh my God, what happens if they leave? Is my unit going to collapse? So those kind of things led to projects and led to us thinking. So we thought out of the box, and we started the MS embryology course with JSS University. So every challenge that was there, for some reason, it turned out to be a blessing in disguise. So I felt in my own mind, I'm not going to be threatened by anybody. I can't bear it, and I can't stand it. So I'm going to flood the market with embryologists. So that's why we took on, and it was the first embryology course that was being held in Bangalore. In Karnataka, there was only Manipal that was doing it. So we started the embryology course, and now we've had plenty of people going through it. The second thing is that other challenge that was there is, when I came back in 2000, after having spent 7 years in England, there were only 2 IVF centers in the state. By 2012, we must have had about 30 IVF centers, and now by 2020, we have 160 centers. So in Bangalore alone. So really, it's a huge challenge. So what happened was that our patient profile started to change. ethics in the market start to change, and there was a huge, now whatever we had never done before, things like marketing, I had never even thought of marketing. That was happening in the market now. And whether you accepted their ways of marketing or not, that was a completely different story. Some were ethical, some ethics is I have understood that ethics is a very broad definition. So what is ethical to you may not be ethical to somebody else. I mean, may be unethical to somebody else, and what is unethical to somebody else may be ethical to you. So a lot of bizarre marketing practices started off, and so we had to kind of keep our mindsets right on track and say, okay, this is what I'm going to do. Define it for yourself. That was the second challenge. Third was, because we had one IVF center in every road, we started to get a lot more patients who were, shall we say, had repeated failures. And so we were now becoming like a tertiary referral center for failed IVFs or failed miscarriages, failed pregnancies, failed recurrent implantation failures. And so that brought about newer technology. So we started to say, well, how are we going to be different? How are we going to be placed different? So we had our embryoscope for people who had recurrent failures. We brought in our PGD, our own in-house PGDs, and now we are the only center in South India right now who has the RFID system. So really, that paved the way to a lot of innovation and newer technology. And I felt that's how you have to kind of go ahead, and that's how you make a path for yourself. And insecurities are some things which help you. I have found that to push you forward, and I get very angry with insecurities. makes me want to fight it, and makes me want to kind of get away from it. But it is very difficult to walk in somebody else's footsteps. It is. And you're not only your colleagues and your other people, it's your staff, everybody's watching you, including your patients. Patients will come and tell you, oh, when your mother was there, it was like this, and now when you're there, it is like this. We're not happy. Okay, what can I do?
Thank you, Devika. I think it was really, really very well said that we're keeping to the core values, which you really, treasure so much, not letting go of them. And also, trying to prove in somebody else's shoes. I think that you've done marvelously well, because all that people will say now is, she had a base. Look at the way she's used the challenges as opportunities. Look at the way she has expanded and scaled to what more could have happened. Because if everybody's starting point is scratch, you're already there and you cashed on this and did more than what one have envisaged. So once again, congratulations to you.
Thank you very much,
just like how she said, she flooded the market with embryologists. This brings us to the point, Dr. Vidya Bhat. 30 million deliveries in our country is what we say. That is an oft-quoted number, and that's a huge number. At the same time, this morning, Dr. Malhotra and the rest were there in the discussions where they said there are 30 million fertile couples in the Indian population. So the challenge is, huge, because the numbers are so many. So flooding with embryologists, equally well, you will need to flood with skilled, trained, so many number of IVF specialists who do a good job in number of the centers, which Devika has mentioned, from 2 to 10 to 160 to thousands in the whole country. So you have been at the forefront as one of our young talents already, not at all trying to be insecure in lending the talent to many other fellows and many from the generation next to upscale them. So what has been your reflections and experience? Why did you want to do all this? You could have kept everything to yourself and said, I will excel. This is a competitive world. So, so what was your thought process?
Thank you, madam, at the outset for giving me this opportunity. You've always seen me as child grow, I would say, since 98 when I entered into practice. I started off as a obstetrician gynecologist, and then maybe I had scaled to get trained in ultrasound and then endoscopic surgery. When I took up endoscopic surgery in the beginning, that was in 1999, when endoscopic surgery was just into everybody's like, okay, they're getting trained with Paul, they're getting trained with Dr. Hafiz, Dr. Paul, like that. Karnataka, I think just Dr. B. Ramesh had started endoscopic surgeries, and I was one of those youngsters who just started doing ovarian drilling and maybe lap ligations. But that's when I realized that it is just not the basic training. We have to scale ourselves, we have to improve in endoscopic surgeries. And major chunk of our endoscopic surgery is fertility enhancing surgeries, because whatever we get, the challenges in endoscopic surgery, may it be myomectomy, endometriosis, or uterine anomalies, has to be by a skilled surgeon. So just a basic ovarian drilling or doing a diagnostic laparoscopy is not at all sufficient, because whenever I had to do the case, I always felt that as a woman endoscopic surgeon, it was not enough when we did these basic work. Because at a time, we just put a scope and realized that it is bad endometriosis. Whom do you get? You don't get a surgeon, you don't get a GI surgeon, you don't get anybody to help you. And you are in a setup where, okay, I have to manage this. And it is unfair on our part to do just a diagnostic laparoscopy and leave the rest of the pathology and then allow somebody to take over at a later date, which is completely wrong. So that is where I realized that just basic work in endoscopy will not be helpful. So I started going pillar to pole to all the top endoscopic surgeons and learning the better skills of endoscopy. Though I had a GI surgeon at my center who would help me out, but I felt from a gynecological point of view, a GI surgeon will not be able to help me, or even a surgeon will not be able to help me, or urologist, whoever it is. So I started going to Mumbai and then seeing all the top people working and how they suture and learning the suturing skills, like Dr. Rakesh Sinha. I mean, it's a tribute to him whenever I think about him, because I've learned the suturing skills from him. So then I realized that if it is not just sufficient, you know the suturing skills. You should always teach the generation next to do how to do suturing, because everybody thought a woman endoscopic surgeon doing suturing, no, they are not able to do. A woman can't do it. That was the idea which everybody had. But when you start doing a good endoscopic surgery, they definitely will look high upon you. So that's when I started practicing. You won't believe me, 6 months, every day, 1 to 2 hours on my pelvic trainer, I have practiced suturing to attain whatever suturing I know today. So that is the kind of efforts we had to put in. And then, of course, once I realized that I could do a good endoscopic surgery, then I found that, okay, I'm lacking something. And that's when I realized that I have to start an IVF center, because it was just not endoscopic surgery. Yes, a black belt endoscopic surgeon is necessary for a good IVF center. I'm sure all of you will agree. The top the top IVF specialists. But then I said, no, I have to learn IVF also. And as all others said, I had to go to the legend Gunasheela madam to learn the basics of endoscopy. And she taught me the first ovum pickup. I still remember how she held my hand and taught me the first ovum pickup. And that's when I started IVF, and then it was no looking back. But later I realized that there was a lacunae between these two, the endoscopic surgeons and IVF specialists. Well, the training has to go on coincidentally, because only when you know good endoscopic surgery, you can do a good IVF. And it is vice versa also. A good IVF specialist will know when and what to do in endoscopy and what not to do in endoscopy, because there are so many times we see lateral dissections, ureteric dissections done, which is not necessary. So that there is a thin line between what is necessary and what is not necessary. So that is when we had to give a clear picture to all these students who came, and I started training these students. Of course, ma'am, I remember you coming and approving my ICOG training, and then only I started training. And then I realized my skills are less to train people. And that's when I said I have to learn endoscopic surgeries for lateral pelvic wall. And then I had to do more and more advanced work. And that's when I went to Puntambekar and some of the 1 or 2 French IVF, endoscopy centers, to learn lateral pelvic wall, to train my students that this is the right way you will have to do it when you have a endoscopic, endometriosis, which you have to tackle endoscopically. So not only train people, but bring out people who are trained and who can do a good work. So I can proudly say that the girls who are trained by me are doing good endoscopic and IVF work today. And after that, even more, I went one step ahead to adopt a corporation hospital where I do free endoscopic surgeries and train these students. And today, the people who come out trained with me say, Madam, I am doing hysterectomy very comfortably. I am doing endoscopic surgeries. My IVF results are very good. And I think that's been my journey. And I look forward to do more work, ma'am. Thanks for this opportunity.
Excellent. This is Dr. Vidya Bhat from the Radhakrishna Multispeciality Hospital in the city of Bengaluru, and who is not only toying with the idea of sharing the skills with a larger number of people, because that's what the country needs, and also a cohesive training to wholesomely manage infertile couples, so to say, and also the concept of public-private partnership, not sitting in the ivory towers of a high-cost IVF center, but also lending as a social responsibility the support to municipal or the corporation hospitals as a share basis, so that it is good for the trainees to get more work as well, the supervision of experts like yourself, and also pass on the benefit where there was none. So again, I must place on the records my sincere appreciation for you, Vidya. Well done and going. Okay, we shift to Shefali ji from the Asia Hospital. Shefali, my question to you is, each of the stalwarts here have said how much efforts they had to put in, not only to train, but to set up and get things moving, etc. Considering there's so many IVF centers, how did they all do it? Do you think each one will need that kind of a struggle and that expertise, or the way the centers are coming up, okay, you're an OBGYN, you need not by default have a special qualification for the IVF work, but you can just, hook up get some instruments. There are some people who outsource like a marriage contract. Will come, put up everything, and you start to work. So that, say you're in a small town, so you want to reach the people out there. So why not this? What is your take on that? This and that. You're doing your obstetrics on one side because you have the expertise.
Good afternoon, ma'am. It's really nice to be on this panel, and I'm really enjoying the talk. I would like to give a little brief introduction of myself, because, right from childhood, a child is born in the hospital. But I had been brought up in the hospital because my mother was very sick and she was a paraplegic lady. So that is how I was destined to become a doctor. Later, since I had seen a lot of sorrows and, sufferings of women, I became a gynecologist. And then finally, an IVF specialist, because I'm a hardcore IVF specialist. I don't practice obstetrics. But the initial days, as you said about the struggle, I think that's a very valid question, because when we started 25 years back, the situation was really bad. Because there were no teaching centers, there were nowhere that we could get, the guidance, and the places that we visited. I mean, me and my husband, we visited people who never used to show the entire setup, and it was really difficult until I went to Belgium. I took training, and that is how, it was a very unfortunate part of the whole curriculum that nothing could be done. As far as, I would like to say that it was really difficult to get into IVF at that time, because that was just a dream, which was really, it was a dream of a young postgraduate, aspiring practitioner, that how will I accomplish it? Because when I was doing my post-graduation, I always have had some affinity towards infertility. I distinctly remember an incident that when I was doing my post-graduation, I was in a busy OPD in a government setup. And, out of the queue, one lady came who was quite elderly. And she came up to me and just handed over with her face was, I still remember her face, and she just kept 100 rupees note in my hand. Before I could answer and, react to it, she said, Madam, you will not remember me, but, you wrote some medicine and I conceived after so many years. And that was the joy. And she could, how she could approach me and reach me. That was something. And that day I decided that, no, I think this is the biggest sorrow of women's life. And achieving motherhood is the greatest pleasure or joy that you could give to someone. And that is the time when I decided, because we started from the scratch, as I never had any background of doctors in my family, because I had always struggled. And but then I was a brave girl, and I really wanted to accept all the challenges that came through. Then me and my husband, he was a chest physician. But then the same old story as somebody narrated, that the embryologist left and this and that, and the same things, going for trainings again and again. So finally he had to quit his roaring practice and join me. So that was, another episode which I would like to bring about and tell everyone that, things are not so easy in IVF. It is always a challenging situation. Other things that you have to give result. You will not get patients until you are going to give them the result. And that was the biggest challenge, because the company persons coming, use this gonadotropin. You will get a very good pregnancy rate. Just fix up this instrument. Just fix up, do this. So, as a young practicing doctor, you fail to understand that what we should do and how it should be done. But ultimately, I would just thank God for giving so much of, support and the knowledge and the sharing of experiences from people around who had always been instrumental in the success, the ultimate success that you go through IVF. So this is how it goes on. So actually it is very difficult. Nowadays, thankfully, there are training courses of reproductive biology and people can get training. But at our times, everything was indigenous and we had to struggle a long way. But now if anybody comes to my center, they want to understand, know anything, my center is always open for any kind of help. That I usually invite the postgraduates, just come and have a look how it should be done, what should be done, because I have undergone through a very difficult times. So I would never want anybody else to, struggle in that manner. So that is how it goes on, I think.
Excellent. I think this is a brilliant set of very generous, leaders in our own country who want to not only care, but also to share. And the incidents, the storytelling about that elderly women coming and giving you a note, acknowledgement years later, because maybe that time she couldn't have afforded anything. And now, the joy that you have seen, it never vanishes through the years. This brings us to a reflection of what our country and the government, or people in general who have many children or some number of wanted children, how they look at it somewhat, my mind, insensitively. This is incidentally a fortnight of world population explosion. They say India is already 1.3 billion, and then why do you want to give so much import? Whenever we have the dialogues with the government, there's a no for many of the infertility driven policies and insurances and a lot of things that we want to discuss with them. The doors are shut even before the start of the discussion, because this is seemingly not an issue for this overtly populated country. But you have brought out real genuine points about how it makes a difference to an individual couple, and all the individuals are those who make up our society. So thank you very, very much, Shefali, for sharing your story. We now come to Neharika Malhotra, and in the backdrop of so many things, if anybody has watched Republic TV in the recent past, there's so much about nepotism and the star kids, etc., etc. So this is our star kid, but we know how hard she has worked and how talented she is. She now heads the chairman's position for the Young Talent Committee, because we want more of her tribe to prosper in our organization as well. Because this is not the time to hold on to your chairs, to hold on to your position, no matter what your age is. We need the generation next to lead us with innovative ideas, with more action points, as if it were to happen in our country. So the question I want to ask Neharika is, yes, you had it all, supportive parents, no gender distinction, because I've seen it, in your family right through. There is so much transparency with everything that is happening, and we really admire that. So just tell us about, the kind of profile of patients coming to you in your own setup, Rainbow, as it's called. They be of this generation. What are their trust deficit, attitudinal problems? They've already, seen Dr. Google and they say they know it all, and then they feel you are approachable. And your parents, what has been your experience on these lines?
Thank you, Dr. Hema, and thank you everyone for having me here. I would just like to add one thing. When I was in 10th standard, I never wanted to become a doctor. And then that time there was a choice of taking maths and biology, and then I suddenly realized, oh, mujhe to aur kuch aata hi nahi hai except biology, because that's what I've seen. I'm the 4th generation of doctors in my family, and I couldn't. Then came 12th. Then I said, I don't want to give any entrance exams. I'm too scared of them. And then suddenly I realized, mujhe gynec ke siva kuch nahi aata hai, so I have to go through what I know the best. It was a journey. At every step, I was in confusion. But then when I entered my post-graduation, I realized, oh, this is what I love. And this is what is my passion. And so I was a hardcore obstetrician. I always admired my dad and wanted to follow his footsteps. And slowly, after seeing him through these years, I knew that I had to know it all to come up to a level where I want to be. And then that's when I realized I had to learn fetal medicine, and I went to Professor Nicloides for training. Then I went to ART, then I went to Germany to get trained, leaving my child behind with my parents and my child's birth. I missed my child's birthday also during that time. But then I realized that training is very important. And the second thing which is important is hard work and perseverance. I know a lot of nepotism, people do talk about it, but if you don't work hard, you will still not go anywhere. So that is something which is important. And now when I see a difference between what my parents were practicing and now what I am practicing, there's a huge shift of attitude of patients. That mental disposition or the mindset has completely changed. Patients are more career oriented. Patients have late marriages. There's a huge lifestyle which has changed. Irregular sleep habits, irregular food habits, and the concept of window shopping and Googling. And there's a lot of mistrust which has happened. And these patients also want immediate results. And infertility is something where we cannot give them immediate results. Infertility is something where it is individualized. So even if a center says I have 70% success rate or 40% success rate doesn't matter to you. It will be 100% for you or 0% for you.
Absolutely.
And that's what we have to counsel our patients. And second thing which I feel is we don't need 2 successful doctors. What we actually now need is healers or storytellers or pacemakers, because the lifestyle and the mistrust which has happened, we have to now normalize that. And I think we have to actually now add that life into the life. And that's what is very important.
Yeah. And then do you see most of the senior practitioners, they tend to get very irritated with the patients who think that, all these, who are half their age from the IT profession, they'll come with all those documents and say, and then, attitude and the tone and their body language, it's definitely not comfortable for the senior order. How do you at your age, deal with these? High-five.
Actually, feel that I share my personal experiences with them. I've had 2 pregnancies and I've had tough ones. I think I was an open obstetric book in my 2nd pregnancy. So, when you share some personal experiences with them, they accept you more. And I'm thankful that I'm at that age group where I can relate to them.
Yes.
all their problems which they have in their, all those mother-in-law issues or all those career issues, because they are planning pregnancy, their career will become on hold. So I know I can relate to that. So when you discuss them you have to give them a little extra time. And that's what is important. I'll see 10 patients in a day, but I know each one of my patients will go home satisfied. And that's what is my aim.
So instead of repeatedly, cribbing about the trust deficit, you make attempts to build the trust.
Yes, definitely.
Any which ways that you can, and that really, really helps. So thank you, Neharika, for this lovely inputs from the lovely budding doctor who will make it big. We already see that written on the wall. So congratulations. We shift to Rekha Rajesh from Hosur. She has the Vijay Hospital, which is a very big center, which is NABH accredited, and also the Manyata Center. And I want to specifically ask Rekha two things. One is, we cannot escape out of talking about the COVID in this corona pandemic. So, at your place with especially ART, that some couples are scared to get into the ART cycles now, because we ourselves know very little about what can happen to the pregnancies. And some of the ART practitioners are also, very sad at this point in time that many things had to be abandoned, and then, when to restart, what to do. So what has been your experience on that in the COVID pandemic? Second question to you following that is, the area where you're practicing, it's not a metro, okay, where by default most things will be less priced than in big cities. Okay, so how do you deal with this expectation of a real low cost ART procedures which patients may demand?
Good afternoon, everybody, and I thank Hema Madam for having me on this panel, and Jayam Madam for being here with us. And for me, the journey is a very different experience, not like Devika or Neharika. Yeah, but I'd like to just add a few things about myself before starting and answering Madam. My journey began with Dr. Gunasheela. I was delivered by her. So that's one thing I need to tell Devika also. So she was working in the government setup at that time, and my mom then decided that I will be a doctor. So my journey began way then. And then once I became a doctor, and then I worked under the right kind of teachers. I worked under Dr. Jayam Narendra, then I worked under Dr. Rita Maskar, who are stalwarts in them by themselves. And so I've got the right people at the right time is what I should say. So that's how I got led into being a gynecologist, because I did OBG before my PG. And then during my PG, I had one guide and mentor, Dr. Shakuntala, who was from a retired BMC professor. Again, she was hand-holding me every time. So these three people are very important in my milestones. And I always looked up to Dr. Gigi and Jayam Kannan Madam. And one time when I met Jayam Kannan Madam in a conference, she had tonsured her head. And she said, I prayed for a patient, and I have done this for this patient, she said. And I said, my God, infertility is like this. Can she make doctors do this? This field will make doctors think so much for the patient. They're so empathetic with the patient. And that's when my infertility journey started. And that's when I started training. I started all the training of infertility. And today, looking back, I paid 25,000 to go to see a lab at Bombay, and they just showed it to me through the pass box. So that was the situation where we waited for 2 days to see a lab through a pass box. So that's one thing that I actually correlate with Dr. Vidya Bhat, and feel that I need to share the knowledge that I have learned and not give anybody who comes to me a difficult time. So in this way, I have evolved, and my center is there since 12 years now. I started from scratch. I set up an IUI lab, preparing patients, and working with Dr. Nirmala, who was very supportive to me at that particular time. So my lab has evolved after that. But today, if you see, there's a regular comparison between Hosur and Bangalore. We are just a stone's throw away. Narayana Hridayalaya is 10 kilometers away, from 15 kilometers away, and then bang into Bangalore, there is there. But then we have patients who feel, the facilities are better there, even though they are high price, they want to go there. So how do I retain this patient was my biggest challenge. So I had to give them an infrastructure which was at equal standard, or in fact better than some of the centers in Bangalore. Then I wanted to have a quality accreditation. So I kept quality in the forefront. And costing, we have worked on such a way that we work with the patient, because I have all employee category, insurance is not covering. and then they have to pay out of the pockets, and no bank loans, EMIs, nothing is possible in a 3-tier city like mine. So costing had to be kept in mind, and so we had to work out. I do a lot of low cost IVF, and we work at very less margins. So that's how my patient batch is here with me. But now in the COVID era, yes, they have a lot of insecurities, they have a confusion. So we have these two ends of the spectrum. In one end, these people who have been prepared for fertility have started staying at home together and cohabiting well. And in this 3-4 months, I've had many of my patients conceive. And so the psychological impact has come down because of the work stress coming down. So that's the biggest boon of this lockdown that has happened. But on the other side, we have people who are aging, who are POF, and who are getting agitated about not having the treatment at the time they wanted. So for these people, we need to repeatedly counsel them, tell them the risk and consequences of this pandemic, and make them understand, and then travel the journey. Here at every step now, compared to before, we need to counsel them much more, because their fear is, one, they need to conceive. The second, during this pandemic, if they conceive, what will be the consequences for the offspring that they are having? So, and here we're having a lot of middle class people again. So the social pressure is very high in the sense that there are people who are at breakdown level. So we have to work with them. We cannot say I'm not going to work. So in that situation, we do tell them that we will take the risk together, travel the journey together, and face whatever the outcomes that are coming together. So unless they understand, we will not be able to do this successfully. And at every given time, whenever we have a challenge, science and technology does come in front, but most of the times it is nature and God who stand by us and give us these results. I have seen that emphasis every day in my life. And the journey I have traveled with my patients in this COVID area, they are very, very much more comfortable. In fact, they are so much better off now that they understand our stress, that we are working in such restricted boundaries and in a place like this where we are taking the risk for the patient. So now they are more empathetic with us, and they understand our timings, and they don't mind waiting for some time. So I think actually this lockdown has done quite a bit of good things, especially for the infertile couples. And treating costs, madam, yes, we have to keep that in mind. Keeping the patient in mind, we need to work towards them. So in my center, we do a lot of costing based on the patient.
Yeah, so thank you, Rekha. I think you've stressed on quality and how you can cut down your margins and bring down your costs, and how now the patients are having a better understanding of us. But I just want a small follow-up question. Like it has happened in many of the private centers. Have your staff got frightened because of the COVID situation and run away? Half of them, their hometowns, and not reporting back to duty?
Touchwood, ma'am. Luckily, they're my support and they're my backbone. And in fact, they take care of all the lacunas that sometimes I'm a little bit careless. The patient comes and tells me, "Ma'am, I just need to see your face. Please remove the mask." If I remove the mask, my staff in front of me kind of says, "Ma'am, you're not supposed to do that." And they tell the patient, "You wear the mask and don't remove it till you come out of the consultation room." And at the same time, they counsel them before they bring them in. So my staff have been very supportive in this place. They standing by me has been a blessing for me, madam, today. And luckily, you have seen my team, Jayam, Kannan, madam, and Hema, madam. Yes. So they really are working very hard during this. We have 2 blocks, madam, where we are doing one as a fever block and one non-fever block. So we see that the OBG and infertility seen in the non-fever block. That's the new block. The old block we have cordoned completely and do only fever cases. So we build the confidence with the patient that yes, we are not mixing the two, and we are giving you separate areas where you are taken care of and you're safe to come to us. So that way, I think my practice is, the patients are coming in with a lot of trust.
Again, this is a very, very big message to all our viewers. Can everybody mute, please? Ziba Patna, Daksha Upadhyay. Yeah, can you just mute your systems, please? Somebody who's joined on the Redmi as well. So, to all the viewers, we would like to say that in this corona pandemic, where everybody is throwing so much negativity around, look at our doctors here. They have figured out what to do and how to do, and they're so positive, and they're actually welcoming this situation, somehow turning their attitude and mindset that maybe this is the best thing to happen. Yes, mental stress is so much stressed upon in the present time, helplines and more than 30%. Now that's the focus. Yes, that is the focus, but with reassuring doctors like those whom you see on your screen here. So I think the patients working from home, looking at it as a positive impact that it have had, and there are certain other things that maybe you have told them, make them feel that this is the best that could have happened, to reflect on what they're doing and why they're doing. So that's a very different perspective. Whenever we say women first, there's been a lot of women on this show who've gone first, second, third, fourth, fifth, sixth, and then the man who is waiting very, very patiently in the wings, Dr. Nayar. Welcome to the discussion. Dr. KD Nayar is from Akanksha Center, and welcome, sir. And when Vidya brought out some gender equity issues, that women cannot perform the laparoscopy as good as the male counterparts, was what her opinion at the start. But then many women have excelled, and our own organization proves many women in the position of the helm of the organizations who performed really well. Most of our members, thousands and thousands of female gynecologists, for a country who still thinks that there is a lot happening with a lot more to happen with women's education, etc. So we have come a long way, and you see gender inequity in this panel. We've got so many of the accomplished leading stars of our country. So a very warm and hearty welcome to you. Is your thoughts about how couple looks at you as a fertility specialist? Are the women equally comfortable sharing their problems and the solutions that you offer, and male counterparts? Because now I think at least society has begun to realize that the males also need to play a role, not only in the discussion but also as a part of their own assessment and treatment. So how do you look at all this now compared to a few years ago? So,
when I look back in 1973 or 1974, when I was doing my MBBS, and we had a labor posting, that is how I get attracted towards OB-GYN as a specialty. That is how, when we started delivering the babies,
yes,
that is the first time I started looking at babies, how they are being delivered, and I became fascinated by this specialty. And over course of time, I did my internship, house job. 1978, I was doing my diploma when this Louis Brown was born. So that was a news for us as a postgraduate also, that this is something which is happening in the world. And I put it in the back of my mind that in course of time, once I finish my specialization, my MD, my residency, probably I'll go and look what is happening in that part of the world. It was from Bonn, not from clinic. In course of time, I finished my MD, my residency. I went abroad. I went to UK also, to Sheffield Center, to saw how they are working, got a training there. Came back to India in 2001. I went wholeheartedly into OB-GYN practice, doing deliveries, hysterectomies, running here and there, cesarean. Then I say, now enough. I have to, what I picked up from abroad, I must go into IVF. So we established our IVF center 2001, and we have progressed from that day. We started with IUI, we started with IVF. I was the seventh center in Delhi that time. When I look back as a male gynecologist, there were always some hesitation on part of the woman to come to me, but the patient were coming to me whenever they needed any operative work. Whenever they needed any operative work, they don't mind coming to me. That was when I was doing OB-GYN practice. But when I started shifted to infertility practice, the couple started coming to me as a priority, you see, because I was the seventh IVF center in Delhi. There were other six centers. Two were run by males and other was run by female, and I could generate a clientage of my own. So the women were not hesitant to come to a male gynecologist for infertility. That was something which I realized, and I worked on this. Now we are a established center in Delhi. We have a training, we have a fellowship courses going on, and all this thing has really given me a lot of pleasure and satisfaction that I could do justice to my specialization in OB-GYN that I picked up infertility as a subspecialty. Now, since last 10, 12 years, I'm only into infertility. I'm no more doing OB-GYN. So
Uh,
patient attitude has changed, you see.
yeah.
Patient attitude has changed. When they want to see infertility specialist, they can come to even male gynecologist.
And the men, what is their attitude over the years? You have been in some decades of practice, so originally we all remember the experiences of the male member not even wanting it, maybe the women and her mother-in-law at the most, no, whatever happens or whatever you do it for me. That's, when
Yeah,
we say
generally
the change is not easy, but change is happening
change
for
has
sure.
happened. Change has happened because
Yes.
I'm from Delhi, so I know from Delhi.
Mhm.
A change has happened. The men are forthcoming. You see, they are forthcoming. What is their problem? They are even not ashamed now to talk about their personal issues. You see, way back when I look 20 years back, 25 years back, men were little hesitant, but now they are no more hesitant. They are forthcoming with their own problems, which is a definite change.
So, thank you for your input, sir. I think we've gone a whole circle round the journeys and the experiences, and I think all the audience here are convinced that there has been a massive amount of determination, commitment, and hard work to work their way around all the challenges, bring the best of the care to all of you who have it right here with the doctors who are so committed and concerned with the cause which hold hands sometimes, contrary to opinion that the doctors will never flex their minds and they do not know what our problem is, and they are ready to walk a mile ahead holding hands. That is the impairment of the practitioners in the country. So by and large, when you paint the practice in private sector as some who will only look at the commercial, here I have presented to you a whole array of leading IVF specialists in the country who have a totally different angle and perspective to the whole issue, and you will have many, many more like this. So you start with your positive feeling of trusting your doctor. That's how you trust God in the first place. Let the old time thinking of doctors are gods come back in spirit, because we know that we are not gods. We know we have limitations. that is a given. But the distress will not anyhow get both the parties anywhere. So we are back on a last rapid fire round of reflections on any one happening that's made you exceedingly happy or exceedingly sad. An encounter with the patient which has made. Now you've said how you have lived up to whatever expectations that has. So Jayam, you go first.
Yeah. Yeah.
Anything that you cannot forget,
Yes.
good or bad?
I am always an obstetrician and ART person. I just give you the obstetric ART success. 2012, Gravida 9, the thing, she is married since 12 years. She had 8 pregnancies. First 5, repeated pregnancy loss. 6th, hysterotomy done. Had accidental hemorrhage and had 2 units of blood transfusion. 7th, rupture uterus at 22 weeks, all outside my center. And she has, somehow her uterus was retained. And now she comes to me telling me that she has to conceive. Married 12 years, 8 times she has lost her pregnancies. And her uterus has been sutured after a rupture uterus. Now I keep my heart. And she has been advised in a couple of centers because she had such a fixed uterus, she has to undergo hysterectomy. Then, of course, I decided, having been an obstetrician right from my first delivery with married 6 years operative obstetrics, still I will follow it. So I continued my ART work on her, and for her uterus, which had such a big adenomyosis, I did a triple flap surgery. Vidya should be really wondering what guts this madam had to do a triple flap surgery for endometriosis. I did it. And the patient comes about 110 kilometers from my place, Nagapatnam. And then after the triple flap surgery, she was given they say, home donation because her aim was 0.2. And she conceived in the third sitting. She had the guts to conceive after 2 trials of failed IVF. My heart was in my throat. Rupture uterus, triple flap surgery, and conception. My God. And below poverty line patient. So my daughter-in-law called all the companies for all the progesterone supplements and the tocolytics after 140 days. She was actually kidded in my hospital at Chennai. And we kept a staff with her to keep 24 hours active. And 202 days went. And she started having pain. And I felt tenderness over the uterus. Right. 203rd day, we did deliver a 1.7 kg baby. And the baby is now 7 years. What more Gharbbha Rakshambigai can give me at this time? And this thing is so happy. She has a uterus, she has a baby, she has no more endometriosis, and now she is comfortable. Of course, the same socio-economic data continues because they had the Gaja, cyclone, and they got all these things, problems in the Nagapattinam area. But the baby and mother are fine. I'm so...
Thank you, Jayam. Here, I think we should admire both the patient and the doctor. Because both have had a real hard time. Patient also not giving up, and she's come to the right doctor. Doctor also not giving up. When the heart is in the mouth or whatever, wherever the heart is, your heart is in the right place for the right people. That much I can definitely say this episode, Jayam. So more blessings to you. From the Almighty, the Gharbbha Rakshambigai, the Baba temple, everything. Because, see, there is something beyond. When everybody says, why this patient conceived with the same protocol and the other one doesn't. So it is all play of something much more. However much you say, even in the previous 2 panel discussions, most of the panelists said that we do believe that the universe supports when you mean well and the patient trusts you and both are positive. So this is very, very, we are keen on placing this attitude should percolate into every mind that is watching this program, because that in itself is one of the crucial part of tender loving care and the treatment wrapped around it. So Devika, you have seen almost every panelist here who has got some connect with your mother. And that is really today I'm much more happy with this fond recall of how many more would have had so many more experiences in interacting with her teachings, her philosophy, her guidance, etc. So being, her daughter, with her, beyond her, what has been your most memorable flashback?
Madam, if you talk about memorable, I'm sure all of us have plenty of those. I mean, you can't say that this is because each case is so challenging, and with you also, who also does infertility and obstetrics, we also do the same, and we do a lot of high risk obstetrics. So we've had, huge number of patients who have had recurrent failures to the count of 7 or 8 IVFs, or like Madam was saying, 9th pregnancy with so many, miscarriages in between, and every patient is a challenge. But maybe I should talk about technology. So when you actually sent me that mail, I was thinking, what am I going to say, and which patient am I going to talk about? You have women who have had, babies.
This is the problem of plenty of patients with plenty of complications, and each one is a delight when you achieve the success. So I want you to then give a message to our audience about how much more we have progressed in the ART procedures with the newer technology applied in a proper way. Yeah, please go ahead.
Yeah, so I had this patient who's basically hails from Mysore, but then who's staying in Mysore, but actually are Maharashtrians and from the Vidarbha region. And apparently that region is, they have a lot of sickle cell and thalassemia or something like that. I think sickle cell is very, very prevalent there. So I had this couple who had come to me, and they had 2 miscarriages before, and the husband was an IT, and the wife was a physiotherapist, and it was quite an interesting story. The husband's uncle had started a new genetic lab in that Vidarbha region, and so he had all his family members do the genetic testing for sickle cell. So they all got it done, and they found out that this boy was a carrier for sickle cell, and so was his father or something. And then so many of his aunts also were carriers for sickle cell. Then he met this girl on a matrimonial site. And liked her and etc., and got married to her, and then the uncle marched her off also to say go and have a testing done. So she also found that this girl also was from the same area, and although it was 1 in a million chance that or 1 in so many 1,000 chances that you are going to have the same. You meet somebody on a matrimony site, you don't think that they're going to be a carrier for sickle cell also. Yes. And bang, there she was. And because she was forced by this uncle who said, her husband has sickle cell carrier status, so you also jolly well better have it done. So then they tried, and they were both sickle cell carriers, and then they came back to me, and then they said that, look, we know that we're sickle cell carriers, we want a sickle cell free baby. So, okay, so we did an IVF for them, and she finally got some 15 oocytes, and then we did a PGS, and then we selected those embryos that were normal, and 11 of them were normal, because she's quite a young couple. But then out of the 11, we did a PGD for sickle cell disease, and only 1 embryo was sickle cell free out of the 11, and that was quite surprising. They either were carriers, or they were abnormal, or we could not have transferred them, and there was only 1. And with my heart, my mouth, I transferred that, praying to all the gods that she'll become pregnant, because that was 1 PGD pregnancy that I wanted. And sure enough, my prayers were answered. She had a baby, and until she had a baby, and one thing is that it's not true that IVF pregnancies are, just sail through. They have a lot of complications, a lot of bleeding. First trimester bleeding complications, threatening to miscarriage. Second trimester, again dealt with abnormal placentation, again bleeding, or placenta previa, or PPROMs, and so many things that happen. Cervical incompetence. And luckily, she kind of just went through, and she was one person who sailed through the pregnancy, and she delivered a beautiful baby. And then we did a sickle cell testing on that baby, and luckily it was all fine. So that was something where we use the technology that we have, But otherwise, there are so many memorable moments, and so many patients who come back to you and say thank you very much. And finally, you have to have a divine, intervention in everything that we do, because we're dealing with such high-risk obstetrics and so much of problems, and in such a difficult, environment where people are always ready to throw the stick at the doctor. So I think, I don't know. There are so many moments for me.
Yeah, Devika, this was one occasion where we had a wonderful opportunity to address a massive audience here who also understand our perspective of what we're going through. And we are because we want the best of the things to happen to them. And of course, each one of those memorable experiences have stayed in your memory for good or bad, because there's something happening with everybody that you deal with.
Yes.
So, and then one point which is strongly coming across, that, the doctors also are human beings, and we also pray, and we also believe in divine intervention, and we always wish that each and every patient of us should have this success. And it's very difficult for us to digest the failures as much as it is for the patient as well. So.
And I cannot tell patients, the only thing left is for me to sit and cry with you, but I can't cry with every failure, or I can't cry with every miscarriage,
Absolutely.
But that's how you feel. You feel very bad. And when we all have failures, and we all have successes that make us go on. I think it's the successes that kind of push us on and egg us on to kind of do much better the next time.
This was all about delivering babies to making babies. So delivering babies, we say we deliver a bundle of joy, but making babies is it's a mix of so many complex emotions.
Because you make the baby, and then you need to deliver it. You need to see it to fruition. So that's a long journey.
Yes, absolutely, absolutely. And it's a complex journey with a mix of so many things. Vidya, coming to you, have you ever felt that, enough is enough? Now I just want to give this up and run away? You really need to be tough to battle all this. Vidya, unmute. Unmute.
Yeah, as an endoscopic surgeon, I think many times whenever we have complications, yes, do I really need to do this has come into my mind. But I think I must tell you this incident because she was a lady with previous 2 failed IVFs and bad endometriosis. And then I said, I'll do an endometriosis clearing. And she was completely tutored that if we go in, we are going to have problems because yours is completely a frozen pelvis. Then I said, no, without doing this, it is not possible because even my trial transfer is so difficult. I just can't enter your uterus. So that's when I went inside and did a clearing, completely frozen pelvis. And in the bargain of separating everything, though I was well versed with the lateral pelvic wall, I opened the bowel. So that time it was a big shock. I said, my God, what is this? But I sutured because by then I had started suturing any injury. So I sutured the bowel and then I was praying that nothing should happen to her. And post-operatively, she really did well. And then we did an IVF for her. And she had myasthenia gravis also. So we did an IVF and she conceived. Then as Dr. Devika said that IVF pregnancies are so problematic in the sense there's so much of problems. So she had breathlessness, threatened preterm, all that, and she delivered. After she delivered, then I said, at last you've had a baby, beautiful baby and fine. And then after about 1.5 years, she comes back to me and says, I've missed my period. And she had a spontaneous conception. And this was like
divine intervention.
My endometriosis clearing, I was really very happy because, okay, a frozen pelvis can be brought to a normal pelvis. Like, yes, divine intervention on my side because bowel injuries can lead to death. So, but whenever I have a bowel injury initially, that is my teaching also now. Don't panic. Suture, learn suturing, suture it well on table, and always be under suspicion that whenever you have done a large area of clearing or a lot of adhesions you've cleared, look properly, inspect, and then come out. So that if you miss a bowel injury on table, then it is a catastrophe and disaster. So we have to be careful. Whatever we are doing, we should finish it on table and come out. That's
Thank you, Vidya. Another message to the masses here is, you see anyone successful, when a successful doctor, you know that they have stepped ahead with so many failures, learned their lessons. Again, upset setup time should have been so rapid because they have the next case to go and the next challenge to tackle. So each one is made of a very resilient stuff, and therefore, all of you, when you're talking about disturbances mentally, when just a little things go here and there because of the COVID-19 infection, challenges and the uncertainties in the ART space especially, it's an everyday battle with every patient, and the word resilience is not new to many of our leading practitioners, because that's the way we have to move ahead. Neharika, I know your parents are so positive, so do you lean often on their shoulders and they tell you many stories? Nahi to aisa beta aisa hota hi hai. You know, so do you feel more cushioned and buffered with that kind of a support, or how has your experience been?
Ma'am, I don't think I have felt much cushioned, because my parents have given me a lot of freedom also, and they've kept me to make my own niche and, you know, to grow around. And I would just like to share, you know, being a doctor is not easy. And my first difficult experience was my first year post-graduation. So I did my post-graduation in Sevagram with her. And we used to have almost like 50-60 deliveries a day, and newly postgraduate, you know, entering to a hostel with 3 people, you know, bad food, difficult seniors, you know, it was a tough task. And then this patient comes to our OPD. I was in unit 1, and, you know, she was 4th gravida, unbooked patient in labor, and she delivered a female child. She had previous 3 boys. And she went into shock, and we had to do her hysterectomy. And that time I was just a postgraduate, you know, running for blood, running for prostadine, running for this and that. And she went into the ICU. And, you know, as a postgraduate junior most, I was told to monitor her with that dopamine drip. And I just remember that I was the whole night, you know, the drip was going 10 drops. Now I'll decrease the drip, then I'll increase the drip, because that time we did not have all those equipments which we have now. That is like 9 years back. And we lost her after 2 days. 2 days I didn't go to the hostel. I stayed with her in the ICU. And, you know, I used to go for tea in the morning with her husband and used to pray to the temple. But we still did lose her. That baby girl is named Neharika. I'm still in touch with that patient. But that changed my outlook towards, you know, being a doctor, because I knew that I had to be so strong to handle all these things. And I was like, I was so young that time, and it really did give me a scare. But then I realized that if you do your best and if you still lose, the patients do understand. And they also know that you're doing your best.
I think this was a real touching story, and I do hope the new Neharika who is born out of this, you know, will stand testimony to efforts that you have taken on her beloved mother, and she will also continue to do a lot of good to the society, as how you have been up to, Neharika. You've been one of the finest role models, you know, showcasing yourself as a doer all the time. And on behalf of everybody who is watching this program, we congratulate you, admire your accomplishments, and wish you all the very best. Well done. Shefali, you know, the start of you know, this entire choice of the medical career itself, and the tough journey, it would have certainly, as Devika said, many memories. But is there any one thing that you recall which you want to share with our esteemed audience?
Yeah, definitely, ma'am. There are several memories when the patients get their children, they put them on the lap, they name after you, and, you know, so many things are there. They frame your photographs in the houses, and they literally, you know, call you as gods. So you feel so small. But I remember one incident. This was a business couple, and they were into jewelry making, and very nice couple. So she conceived with IVF, and there were twin pregnancies. And unfortunately, this girl lost her husband during the, you know, treatment while she was pregnant. And finally, she went into premature labor at 20 weeks. And then we had to deliver, out of the twins, we had to deliver one of the twin. And one twin was retained inside. And, you know, we did a circlage, and this girl was so desperate to have her husband's, you know, child, that she literally used to say that, doctor, do something, but I want this child because this is the only memory that I carry of my husband. So I remember those days that I used to stay in the hospital, you know, just what is going to happen, we really didn't know. And finally she progressed till 28 weeks. this girl delivered a female child, again named Shefali, as Neharika said. And this girl comes on her every birthday and wishes me, and they mother and daughter are so happy. So these things, happen with us very often. And ultimately, if it is a happy ending, we should thank God.
So, thanks, Shefali. So, ladies and gentlemen, if you see any Devikas, Vidyas, Neharikas, Shefalis, Rekhas, Jayams, and Nayars in the community, you know from where they're coming. Good job, Rekha. When I first visited Rekha's center, it seemed as though we were going into one narrow lane into another and another. I said, what is she doing, in this corner of the world? But then, it was like a mansion in the desert. When we reached there were so many things happening and so many good things happening, which opened our eyes into so much that can be done if you have the necessary dedication. So, Rekha, any of your flashback minutes?
Like Devika ma'am said, ma'am, every patient is a challenge, and it's like writing an exam and waiting for results. And the failure patients are our supplementaries. So you have to keep on writing till you're successful with them. But there are few patients who actually you carry them in your mind and they come very close to you. One of them is one of my patients who's everybody had told her that she will not conceive. Okay. And then they came for a surrogacy to me. But then she didn't look so bad actually. So she was already into 20 years of married life, and and they had actually given up and they wanted to do a surrogacy. But at that time, that surrogacy cost also they could not take it. So I said, okay, if we don't have any other option, let me try one IVF with you. And luckily, she went through, we got only 4 oocytes, and then we had only 2 embryos. And we did that 2 embryo transfer, and she conceived, and then she had a boy. And the boy made so much of a difference for her in her life, because she had literally been outcast in her whole family. And people were not talking to her, they were not relating with her, and the property was not given to her and her family. So when they came to me, they were on dire straits actually. So everything was done at a compromised rate, only they paid for medicines. So when they have that son, today the whole family has turned around. Now they're one of the topmost people in Krishnagiri, so well off, and then the whole family has got back to them. And they come back every year, madam, on his birthday to meet me and meet the whole hospital staff. The other thing is an own personal experience where when you do it with patients, they go back home and you're not in touch. But when you do it in family, it's even more stressful. So I had to do this for my sister, and she was a 10-year married life, and then she hadn't conceived, and it's such a delicate thing with her in-laws and everything. But anyway, we did the IVF, and then first time she had a miscarriage. Then now second ET, and the second ET she had twins, and I kept her with me, and then we took her, and at 32 weeks she went into PROM. At that time I didn't have an NICU with me, and now what is the next question? So I had to take her back to Bangalore in an ambulance, spoke to friends of mine, delivered her there, I sectioned her there, delivered her there, and then babies were in the NICU, and then we brought them out. And today when I see those 2 little girls jumping, talking, dancing, screaming, I'm telling you, I'm living with science and living with nature and God. And I see that, nature and God flag off every beautiful life that we deliver into this world. And that experience, ma'am, I'm living with it every day. And whenever my sister makes videos and sends it to me, I don't know if yes, patients do come back, but when you see it in your own house, the take home is much more. Okay. That's what they say. So that's where I think I fulfilled my parents' dream also of her having a child, and her dream of becoming a mother. And then her mother-in-law too was very stressed that they may not have a child. So now her mother-in-law interacts with the kids so well, and when you see them all bonding so well and everything going well, I think there's nothing better that I would have received from the future. The career that I chose to have.
Thank you, Rekha. These are such beautiful emotional stories which we got an opportunity to showcase to a larger audience who would not have looked at us with this perspective or this angle. What they mean to us is now what is showcased with the anecdotal. Just one experience out of the many hundreds and thousands of experiences that you have had. And if you just take a kaleidoscopic effect and multiply all of these, just imagine that we are the ones who face the maximum challenges, but in retrospect, we look back at an opportunity to serve and the blessings that we have got to deliver care to all of you. The last word by Dr. Nayar, the finest gentleman, who may recall something on similar lines or totally different. Nayar.
Yeah, Dr. Hema, you see, infertile couple, they undergo so much type of stress, emotional stress, physical stress, financial stress. Whenever they come to you, they come to a infertility specialist. And course of time, and if the procedure become successful, they develop a special bonding with the infertility doctor. I had a young corporate couple, Indian couple, placed in London, underwent 2 cycles of IVF there, failed, came back to India. Their parents called, no, no, come back to India, underwent a third IVF cycle, some other center failed, finally landed at my center, and we did a fourth IVF. Young corporate couple placed in London, their mind is always about them. I did a embryo transfer, and I said we have to wait for 14, 15 days before we check. They have no leave. They cannot stay. The husband went back to join his duty in London, left the wife, the parents here. Every day she was calling, today is one day less, one day less. Shall I do my test tomorrow? Shall I do it after tomorrow? I said, no, wait, wait, wait. Finally, she did a test. It was positive. I said, okay, now your test is positive. Now you can, if you want, you can fly back to London. And after 2 weeks, do a ultrasound and inform me what is the result. She went back to London, called me after 2 weeks. She did a scan, twin pregnancy. Now what to do? I said, no problem. Follow me your obstetrician there. They know. They are well trained to follow the twin pregnancy. After another 2 weeks, she again called me that one of the sac is without heartbeat. Now what to do? She was so worried. You see that one pregnancy is going on and one is there is no heartbeat. I said nothing. The one pregnancy which is going on, it can go on successfully. Don't worry about it. You should think about the pregnancy which is going on, what is already lost, that will resolve its own. Till 34 weeks, this patient was calling me every week, you see. Yeah, this is the obstetrician in London, what they are told, whether this medicine is okay. I say, when you deliver, please call me so that I know you have delivered a baby. And once you come back to India for a visit, then visit me with the baby. I will be very happy. But what I'm saying, these patients undergo so much of stress that they are looking up to their specialists for a long-term bonding, with the long-term dependence is there, and we have to look after this part also. Without this, you cannot be successful. You have to look
Thank
after
you
this.
very much, Dr. Nayar. In keeping with the philosophy of Integrated Health and Well-being Council, IHW Council, it is a true integration indeed, both of the patient and the doctor's mindset, which has been so well showcased by brilliant panelists today. It is also the integration of you having the commitment, patient complying with whatever you have said, you having the trust, and that is reciprocated well. So the major message is that when you do whatever you do good, same comes back to you. So that saying is, you all of you have walked the talk through your own journeys, and many who are serving as frontline warriors in this COVID scenario. They're called the warriors because in their own way, all of us, whichever patient we are dealing with, it's a complex human machine, which has to respond in both intelligence, by knowledge, by your own attitude and intuition and the divine intervention. You have to wholesomely deal with this whole situation. So Kamal Narayan, who's the CEO of the IHW Council, has proposed that there should be a war memorial. Just like the soldiers have their war memorial, the Corona warriors to have their memorial. So the change.org, the petition is being sent right across, and everybody has endorsed it, which means that really people do believe that the contribution from the medical profession is so immense, because health is indeed a wealth. With this, I would bring this brilliant panel to a close, saying my very, very sincere thanks to all my beloved friends and colleagues, Dr. Jayam Kannan, Dr. Rekha Rajesh, Shefali Jain, Neharika, Vidya, Devika Gunasheela, and Dr. Nayar. Thank you so very much.